Hello everyone, this is Savita working in RP IIT Medical and Technical Campus. Today we will discuss on management of behavioral problem in children. Introduction. The child's problem are often multifactorial. Young and older children react differently to stress. Difficult to assess whether the behavior of such children is normal or sufficiently problematical to require intervention. Behavior. Behavior means refer to actions or reaction of an object or organism usually in relation to the environment. Behavior can be conscious or unconscious, overt or covert, and volunteer and involuntary. Behavioral disorder. Behavioral disorder are conditions in which an individual experiences alteration in thinking and emotions that result in challenging behavior. Factor affecting behavior in children: hereditary, temperament, environment, learning condition, positive reinforcement, parenting. Warning sign can include harming or threatening themselves, other people or pets, damaging or destroying property, lying or stealing, not doing well in school, skipping schools, early smoking, drinking or drug use, early sexual activity, frequent tantrums and arguments, consistent hostility towards authority figures. Common disorder in children: habit disorder, learning disabilities, sleep disorder, eating disorders, conduct disorder, ADHD, autism. In infants and young children, habit disorder. Habit disorder is a repetitive behavior. Second one is breath hold spell, evening colic, thumbs up king, and nail biting. First one is habit disorder: temper tantrum, stranger anxiety, fear, tics. Repetitive behavior: begin and self-limiting, begin with between 6 to 10 years. Example: body rocking, head banging on bed and on wall, can result in callus formation, abscessions and contusion. Body rocking: rhythmic forward and backward movement of the trunk that occur mostly in the sitting position. Head banging: rhythmic hitting of the bed against the solid surface, often the crib matter, that can lead to callus, etc. Incidence is 5 to 20% in infancy and toddlers. Repetitive behavior management: padding hard surface, reassure the parents. Parents should ignore the behavior, no punishment. Breath hold spell: provocative event, start crying, cyanotic or pale. Sometimes less loss of consciousness or even seizure can occur. It is child's attempt to control environment, parents and caregivers. Rare before 6 months, peak at 2 years and adapt by 5 years. Management of breath hold spell. History taking: reassure the parents. Iron supplementary 3 mg per kg per day to treat anemia because it can worsen condition. Moreover, it help on decreasing the spell in itself. Child guidance cleaning reference. Next one is evening colic, intermittent episode of abdominal pain and severe crying in young infant who are otherwise well. It is usually begin at 1 to 2 weeks of age, peak in 4 to 6 weeks, up to 3 to 4 months of age. Crying occur in evening, on in afternoon. Diagnosis: cry more than 3 hours, 3 days and 3 weeks. Causes: exact causes unknown. Overactive patient child, hunger, cow milk intolerance, immaturity of the intestine, overfeeding or intake of food within content or carbohydrates, inappropriate handling by the parents. Clinical feature: stern and loud cry, face become red and leg are drawn up on the abdomen become tense, attack sizes when the infant become completely exhausted or after pass of flatus or feces. Management. During episode, hold the child erect or prone in the lap or on the hot water bottle. Avoid drugs, enemas, carminative suppositories. Explain the parents that child is not sick and unburden them. They should be told that all infants are irritable, fuzzy and cry 2 and 3 hours per day. Disgrace the feeding with each cry.